WGN Investigates contact tracing will ramp up in the next few weeks as hundreds of tracers are hired here in Chicago.
That project is getting off the ground months after the pandemic started. Lourdes Duarte walks you through the challenges of this $56 million project.
One of the big challenges right now is getting in touch with people who have the virus. Today, WGN Investigates got a hold of numbers which show that in some cases, contact tracers reach less than half of the people they try to contact. The tracers being hired right now will make calls, guide people to resources, and knock on doors if they have to, all to stop the spread of COVID-19. At Howard Brown Health in Hyde Park.
Hi, this is Beth with Howard Brown. I'm calling from the contact tracing team to follow up with you. Is now a good time for us to chat?
Beth has a screen of questions to get through.
How long have you had this fever for?
A few weeks ago, she shifted her efforts to contact tracing.
But we will contact them to let them know they may have been exposed around the virus.
Led by Dr. John Schneider at Howard Brown. Via Zoom, he chatted with us about more than a decade of work, publishing this in 2013 on contact tracing and HIV. He knows the topic well, so when the COVID-19 pandemic hit, he was ready.
Howard Brown was really the first group to do contact tracing in Illinois.
Not only are they tracing connections, but they're testing for COVID on the ground floor of that center.
The challenge with coronavirus is that, by the time we get to people, they've probably already transmitted to others.
Bring in contact tracing and the monumental effort cities and states throughout the country are taking on.
Contact tracing is one of the most critical tools that we have to reduce our spread rate.
In Chicago, a $56 million grant was awarded to Chicago Cook Workforce Partnership, overseen by Karen Norrington Reeves.
The contact tracers would be making approximately 4,500 calls a day.
Making those calls, potentially people like 21-year-old Thomas Ecker.
So we really try hard to use skills like active listening. We use open-ended questions or leading questions when it's necessary.
A week ago, he completed a College of DuPage course on contact tracing. There's been so much interest in the program that one class became 10.
The students are extremely eager. Many are out of work.
But an opportunity like this can take time to fine-tune. In Chicago, it was supposed to get off the ground next week. It's a little behind schedule. They're now looking at the second week in August. And by mid-September, even more contact tracers will be hired. In all, 600 new hires. The governor's stay-at-home order, shelter-in-place order was March 21st. That's 3-4 months that have gone by. Should this have been in place 2-3 months ago?
So to be clear, the City of Chicago's Department of Public Health has been and is doing its own contact tracing. This is helping to build out that existing labor force.
And she's right. Practically every health department is doing its own tracing. DuPage County, for example, has made more than 11,000 calls since early May. But the challenge is getting people to pick up the phone.
What type of symptoms have you been experiencing?
WGN Investigates obtained numbers from Chicago's health department. Take July 23rd last week. Chicago contact tracers made 138 attempts. They reached 55 people. That means for that single day, they reached 40% of the people they tried.
There's probably about 1 to 2 in someone's network. And, our success rate is now about 1 of them we're able to get in touch with.
With numbers like that, patience is key. Also, the nationwide contact tracing effort doesn't come without controversy. Just this week in New York City, contact tracers called the program a disaster with glitches and poor direction. And in Boston, similar issues. 1,900 tracers became 700 when the governor said they had too many. How do we make sure that the frustrations that they've had in a place like Boston aren't felt here?
What we do is we pay attention to the data, and we pay attention on a daily and weekly basis, and we work very closely with the City Department of Public Health as well as the State Department of Public Health, and then we pivot.
The difference in Chicago, she says, is that the effort is more than the current need for tracers. It's marrying the state's economy with the state's pandemic.
Thank you. Bye.
And only time will tell how that call plays out.
The volume of work is going to ebb and flow, but the need to prepare a public health workforce for tomorrow is going to continue to exist.
And the plan right now is that once the need for contact tracing slows down, some of these workers will move into other sectors of public health. As far as the contact tracing calls some of you may be receiving, health departments are working on ways to easily identify them through caller ID. And important to mention, a tracer would never ask you for Social Security or bank information. I'm Lourdes Duarte, WGN News.